65-year-old woman with a history of heart failure and essential hypertension was hospitalized for dyspnea on exertion and generalized fatigue. Her hematocrit level is 50% and she has a normal red blood cell mass. Arterial blood gas analysis shows an arterial oxygen partial pressure of 73 millimeters mercury. What is the most likely cause of this patient's polycythemia? Now, polycythemia is going to be the increase in red blood cells in the body. We can measure polycythemia by looking at the patient's hematocrit levels. Hematocrit is going to be the percentage of red blood cells in the total volume of blood. If the hematocrit is greater than 48% in females and greater than 52% in males, then this is going to be a case of polycythemia. We can divide polycythemia into two categories by looking at the red blood cell mass. If the red blood cell mass is increased, then this is going to be a case of absolute polycythemia. If the red blood cell mass is normal, then this is going to be a case of relative polycythemia. Relative polycythemia can be commonly caused by dehydration and excessive diuresis. This should make sense because by decreasing the body's volume, we're going to be increasing the hematocrit. Remember, hematocrit is going to be the percentage of red blood cells in the total volume of blood. If we are decreasing the body's volume, then the hematocrit is going to increase, giving us relative polycythemia. Now, if you go back to this question, we see that the patient has a normal red blood cell mass, and she also has a history of heart failure, so she's most likely on diuretics, which can increase her chances of developing relative polycythemia due to her peeing out her body's volume from the diuretics. So as a result, we can safely say that the correct answer is going to be answer choice E, relative erythrocytosis, causing her polycythemia. Now, absolute polycythemia can be divided into polycythemia vera and secondary erythrocytosis by looking at their erythropoietin levels. Erythropoietin is going to be a hormone produced by the interstitial cells in our kidneys, and it is going to travel to the bone marrow to increase the production of red blood cells. Now, in polycythemia vera, we're going to have low erythropoietin levels, and in secondary erythrocytosis, we're going to have high erythropoietin levels. Now, polycythemia vera is going to be caused by a JAK2 kinase mutation in 98% of the cases. This is ultimately going to increase tyrosine kinase activity, which can increase all three cell lines. So not only we get a increase in red blood cells, but we can also get an increase in white blood cells and platelets in polycythemia vera. Now, because we have an increase in red blood cells, we can have a negative feedback going into the kidneys to decrease erythropoietin levels. And so this is why we have a decrease in erythropoietin in polycythemia vera. In secondary erythrocytosis, this is most commonly going to be caused by hypoxia. So if the oxygen saturation is less than 92%, and if the partial pressure of oxygen is less than 65 millimeters mercury, then we can have polycythemia from secondary erythrocytosis. Remember, in the question stem, our patient's partial pressure of oxygen was 73, so this is not going to be a case of secondary erythrocytosis with her. Now, the reason why we have an increase in erythropoietin from hypoxia is because when we have hypoxia, the body is trying to increase the body's oxygen carrying capacity, and it is going to do that by increasing erythropoietin in the kidneys, and then erythropoietin is going to travel to the bone marrow to increase production of red blood cells. So remember that red blood cells have hemoglobin, which carries oxygen, so this is ultimately going to increase the body's oxygen carrying capacity in response to hypoxia. In secondary erythrocytosis, we only expect the red blood cells to be increased because erythropoietin is going to be increasing red blood cells and not platelets or white blood cells. So we would have normal platelets and white blood cells in secondary erythrocytosis. We can also get secondary erythrocytosis from erythropoietin producing tumors.